bring in an expert to help break all this down. Tonight we're joined by Dr. Renee Garrick, the Chief Medical Officer for the Westchester Medical Center Health Network. Dr. Garrick, thanks as always for being with us tonight.
My pleasure.
So, Doctor, what is this data so far? Tell us about AstraZeneca's coronavirus vaccine.
So I think, as Dr. Fauci said, we have more to learn about this. And personally, I think, if anything, this should give all of us a lot of faith in how we go about approving vaccines in our country. There's obviously an enormous amount of transparency. We're able to see the data. The expert monitoring panels review the data. And I think that degree of transparency is exactly what's necessary. And it should give us added faith in the process and added faith in the kind of clarity that goes into these judgments. So personally, I think that when the panels are done and when they've had a chance to review all the data and a final ruling is out and presumably the EUA is granted, if anything, I think that we should be more confident than ever that the vaccine is safe, because it will have gone through added opportunities to clarify their data and to make sure that everyone's had a chance to weigh in on it. So personally, I welcome it. And I think that when the vaccine is ultimately approved, as I think it will be, if anything, we should really be feeling very confident about the safety and efficacy of it.
And Doctor, speaking about safety, we've heard concerns about the shot from overseas where the vaccine has potentially been linked to blood clots. But is there really any evidence of that?
So, whenever you start using something that's new and you use it in large numbers, you have to be very careful about jumping to a conclusion that something that went wrong was necessarily linked to that vaccine. Because things happen. Blood clots happen every day to people all around the world. And it's true that you can have a vaccine and have a blood clot the next day, but that doesn't mean that they're linked. It doesn't mean that it's causal. And that's why in this country, under the EUA that's currently going on with the vaccines with Pfizer and J&J and Moderna, every single side effect is reported either by those of us who are giving the vaccine or by the patients themselves, because we want a huge database. We want to be able to track anything that's going on with the vaccines. And the only way we can do that is by gathering all the data and then actually seeing, is there really causality, or is it just two happenstance things that went on that aren't actually linked in any scientific way? And to do that, you need a big database and you need to look at it with a lot of scrutiny. And that's what the CDC does. And actually, as you know, we've given well over 200,000 doses of the vaccines here, and we've probably managed over 350,000 doses, and we track any possible side effect of those vaccines.
So, Doctor, how do we address vaccine hesitancy? Some people are saying, I'm not confident about these things. You kind of mentioned it surrounding this shot. Even if it gets approved, how do we get over that hump for some of these people?
Yeah. So that's a terrific point, and it's really important, because the idea here is that, first, for us to really conquer this, we have to prevent it. And the only way we have right now of preventing it is with a vaccine, like any other viral illness. And it's understandable right now that people are somewhat hesitant because the vaccines have new technology around them. They came to market not because safety steps were skipped. And I think it's really important for people to understand that. These vaccines went through the same rigorous review and the same rigorous testing that our other vaccines did. The difference is that rather than doing it step by step after each other, the studies were organized so that they were done in parallel. So we gained information about safety and efficacy in parallel rather than doing it sequentially. But the vaccines went through the same safety requirements that every other vaccine in this country have ever had to go through. But people are hesitant, because, as we all know, that there was some politicalization that went on around the vaccine, and people are always nervous about anything that's new. I think for us, vaccine hesitancy is conquered by having role models. So I took it. I made sure that all of my patients knew that I took it. I made sure that we were role models to say, look, this is a really good thing, and we should encourage everyone to get it as one of our mainstays to conquer this pandemic.